Assalamualaikum warahmatullahi wabarakatuh. Hello guys, my name is Mardiah. In this video, I will explain a topic about a child who has delays in speaking or communicating. Okay, the issue that occur in my environment are a child who has delays in speaking or communicating. The child named Dea, where this child has a speech disorders that is incompatible with children his age. There has limit stuttering or less clear speech. My observation, this child has a deficiency since the age of 6 months. Uh, this child has a speech deficiency because at the age of 6 months, this child is sick with a fever that is too high and result in speech delays in developmental delays that are not suitable for children of his age. And next, Dea is now 4 years old, and this child has just started talking but is not clear in communicating. Everyone gives this child the enthusiasm to continue to invite and teach Dea to speak correctly and clearly, even though sometimes as a parent, it is sad to see the condition of the child at this time. However, so far there has been good progress, although only a little, but from the perspective of psycholinguistic theory, this child can recover if he does therapy every day and invites him to continue to communicate with each other. And next, a concept analyzed based on English source from related ebooks related to around me, based on the ebooks Introduction to Psycholinguistics by Amy Sudarwati, Widya Catherine Perdani, and Nia Budiana. Um, this book describes language disorders in children, described in chapter 9, where this book is a very complete explanation of the psycholinguistic of language disorders in children. Meanwhile, parents are generally enthusiastic about waiting for the beginning of their child speech development. If children cannot speak normally, it is not uncommon for them to think that their child is stupid or retarded. The development of a child's speech outside of normal is a matter of concern for parents, so they often take him to the doctor. And next, from the journal related to the issue psycholinguistic model of speech development and their application to clinical practice. This article presents an introduction to psycholinguistic models of speech development. Two specific types of models are address box and arrow models, and connectionist or neural network models. We review some historical and some current models and discuss recent application of such models to management of speech impairment in children. We suggest that there are two ways in which a psycholinguistic approach can influence clinical practice by directly supplementing speech language pathologists, repertoire of assessment and treatment approach, and by offering a new way to conceptualize speech impairment in children. And next, interference language in development of child. As we have seen, the language process begins with encoding semantic, grammatical encoding, and encoding phonology. As semantic encoding and encoding grammatical takes place in the brain, with phonological encoding starts from the brain, then continued its implementation by speech tools involving the system brain nervous or neuromuscular. And the first language development stage on child. Language development is divided into two major periods, namely period pralinguistic 0 until 1 years and linguistic 1 until 5 years. The linguistic period began at the desire of the child to say the words. The first one, which is the most moment amazing for parents, and the second, delays and distraction in children's speech development. The level of development of a person's speech, the child is below the quality level speech development generally can is known from the correct use of vocabulary, the word language of the child when together piece, conference, or talk. Delay in speaking not only affect academic uh, adjustment and the child personality. The most serious influence is against the ability to read on the beginning of the school. Okay, I think that's all. Thank you for your attention. Sorry for my mistake, and assalamualaikum warahmatullahi wabarakatuh.